Hi, I'm Dr. Sarah Wasserbauer, and here's the question. What can I do to stop this coronavirus? Well, as I said in my previous videos, coronavirus mostly lives in your nose. So there might be a topical approach. Now, this is based on all the science that's out there right now. And what I'm trying to help people understand is the different things they can do in addition to hand washing that might help to stop this virus in its tracks. Now, social distancing is an absolute must. You have to do that. Reduce your number of contacts to just your family unit and who you're going to ride this out with. And one other thing that you might be able to do is to reduce the viral burden in the place where coronavirus lives, which in the case of coronavirus, this particular one, COVID-19 likes to live in your nose. Okay, there's a couple of viruses. MRSA comes to mind. It's usually something that people carry around in their nose. Some people can be asymptomatic carriers. And we know that you can carry COVID-19 for 2 to 3 days without even knowing that you've got it. Okay, so one of the things that might be an approach that you can consider, and I have all the data for this, is nasal rinses with the same ingredients that you would use to clean a surface for COVID-19. In other words, we know the virucidal effects of these compounds, okay? And they're not all compounds, but it's something you can make at home. And we have evidence that it works to reduce the viral burden in your nose. And I'm gonna tell you what these are. So you could use a nasal spray of 0.1% sodium hypochlorite or 0.5% of hydrogen peroxide, just a nasal solution, along with a gargle of the same concentrations, okay? You can try and do this at home. I've been doing it. You get a little spray bottle and you spray up your nose, or you hold that there for a little while. It does not hurt. It doesn't make you feel any different. You can also gargle with the same thing. There's also evidence that zinc will help. There's a lot of evidence that zinc will help to reduce the common cold. Remember, coronaviruses are the same ones that cause the cold. That's the family of viruses that causes colds. So if you would like to try that, get some of those zinc-containing gels, nasal sprays, lozenges. You suck on them, and they would help with, they would help with any viruses that live in your throat. What zinc does is, imagine that you've got one of your cells, and here comes the little virus that's trying to attach the cell, inject some DNA, and take over the cell to create more copies of itself. And then once it's done that, the DNA from the virus just explodes the cell, and then millions of these copies of these little viruses then go on and do the exact same thing to other cells all around them. That's how viruses work. What a zinc will do, and what some of these other things will do, what a zinc will do is it will stabilize the membrane. It'll make it like concrete. We're not sure exactly how it works, but zinc stabilizes that membrane, making it harder for that virus to inject the DNA material into that cell and hijack the cell's DNA machinery, okay? So give it a try, see what you like. We're gonna need some more studies to know if this works, but this is definitely something that's absolutely grounded in science, and I'm giving it to you to give it a try. We'll see you later.